begin the recording. Thanks everybody for joining this question and answer information session on contact tracing with the National Peace Corps Association. My name's Dan Baker and I'm the program director for the Global Reentry Program. We have not a very formal program, but a program nonetheless. Here you can see the agenda for this evening. I say this evening because it is 8 p.m. Eastern time, but I know we have people as far west as Alaska. So good afternoon to you. We're gonna just kind of walk through where we are now with the relaunch of the Emergency Response Network, talk a little bit about the opportunities that currently exist with John Barry, who's joining us. And then we have at least 3 contact tracers currently working with NPCA on the line. I just want to give a huge thanks to them because this is above and beyond what we asked them to do. And at least 2 of them are coming off of a shift, which I understand can be pretty grueling, especially after a long week. So thank you for joining. We'll talk a little bit about what we're looking for and the position descriptions we currently have available and how to apply. But what we really want to do is just have an opportunity for you, if you're interested in this work, if you're interested in doing the work, to ask about what we're doing, but also if you're just want to get a sense of what NPCA is doing as a member of our community, that's what we're going to do as well. So just jump right in here. The Emergency Response Network relaunch. We say relaunch because we did emergency response work with the National Peace Corps Association about 20 years ago. There were some domestic emergencies as far back as Hurricane Katrina. NPCA did some response work domestically then. And then we phased out as Peace Corps launched Crisis Corps. We kind of shifted the response work for RPCVs over to Peace Corps agency. But we're relaunching this year, especially with the pandemic. We felt like there was a great opportunity and a real role for NPCA to field teams of contact tracers. And this is a conversation that's been had since the early days, really the weeks or days following the global evacuation of volunteers back in March. We began talking to Peter Kilmark's, a fairly high-level official at NIH and others about getting Peace Corps RPCVs involved. There's even some legislation drafted at one point that never really went anywhere in Congress to engage evacuated volunteers in domestic work. So this was something we jumped on, but as things happen, it took us until August or September. John Barry can say more about this process, till we got any traction with any partners. And it wasn't until October that we began our first partnership with King County Public Health Office in Seattle. And we fielded, we selected a team of 10 and wound up with a team of 8 contact tracers. We're hoping to expand that number. King County is happy enough with us that they would like to see us expand, but we're also talking to other potential partners around the country. And this information session is meant to engage people outside of Washington State for the first time and potentially get involved. This is a program, I should have maybe prefaced, of the National Peace Corps Association Global Reentry Program. Global Reentry is meant to help get RPCVs involved in ongoing service opportunities and to strengthen career prospects and employment opportunities for RPCVs. And this is, I think, just a great landmark event for us as we started this program. NPCA is a small organization and we are quickly rising to the challenge, but we are also learning how to do contact tracing, and I really want to thank this first cohort for being the guinea pigs and the trailblazers as we figure out how to do this. But what is absolutely clear to me is that RPCVs are really good people with good skills to do this sort of work. So I'm going to stop talking and turn it over to John to say a little bit about where we are with partnerships and to introduce, as only John can, the enthusiasm that we have around contact tracing.
Well, Dan, you're leaving me with a mental image there of a trailblazing guinea pig, and I'm not sure quite what to do with it. But we've got our trailblazing guinea pigs right here with us, and I just want to thank Ava and Lauren and Jerome again for putting in the extra hours and the extra effort after I know what's already been a long day. So we appreciate you guys. So. Yeah, so it's a funny thing because this all started, as much does with Peace Corps. It just starts with a conversation and a kind of a what about conversation. So this was early April this year. I was in touch with Glenn Bloomhorst, who is the president CEO of Peace Corps Association. And I said, Glenn, you know what can we do? And of course, that conversation already started in DC, and so there was kind of a leadership group that got together and just started talking through, well, how can we respond? Because it seemed that were two needs that kind of went together. That we thought, well, there's just got to be a solution here. And the first need was the evacuated volunteers, the 7,300 folks who had just gotten evacuated and lost their jobs and livelihoods, and we wanted to figure a way to help them. And then the second need, of course, was for contact tracing. Like all great ideas, it was easier in the talking about than in the doing. But slowly we started to have a national level conversation. We've talked to hundreds, literally, of people. At one point, I was on the phone with 4 admirals from the Indian Health Service. We talked to folks in Oklahoma, we talked to folks in Pennsylvania and Montana, in Washington State, and all over the country, trying to find partners and also mechanisms through which we could offer collaboration and offer support and match volunteers with these contact tracing positions, because we just felt like that skill set, the cross-cultural skills, the communication skills, just that kind of desire to serve, meant that return volunteers would be natural candidates for these positions. So, long story short, fast forward from April till probably August, we were kind of just looking for people to talk to. And finally, King County said, yes, we want 10 of you. And so we started to structure that and build out a team and interview folks. And it's been a long process to get us here. But the team started, I guess, in early November. So they've been at it for a month and a half. And already in that time, King County has recognized what a great job they're doing and has asked for 10 more. So one of the things that we can talk about a little bit later is that, I mentioned the word mechanisms, and it's just tough. I mean, everything that you hear about how discoordinated the effort is, to respond to COVID is absolutely true, and I think we can attest to it from a public health point of view. The fact is we're contracted with King County, Washington. At the same time, we're carrying on a conversation with Washington State Department of Health and Colorado Department of Health and Pennsylvania Department of Health. But it's just it's a kind of a state by state, community by community almost approach. And so with the contact tracers here and the King County, they have said that they prefer folks from Washington State. But we're still in the process of negotiating with them to recruit nationally. We don't see any technical reasons that we couldn't recruit nationally. It's been done before. And so we're still optimistic that we're going to be able to hire folks at a national scale. Another conversation that we had earlier this week, while obviously there's some fierce urgency to respond to the COVID crisis now, the COVID crisis is not going away. And so we were talking to some folks about hiring contact tracers that would be starting in the spring or early summer. So there will be a continued need for contact tracers, and we do find that it's been phenomenal seeing how quickly the team picked up on this. It's a tough job, but we did the way we created it was as a team-based approach, because we knew that it was going to be a tough job, and we knew that having that kind of mutual support that being in a team offers was going to be vital to just helping people to, have somebody to ask questions through to talk to about, when the day didn't go right. And so it's been great to see how the team has kind of coalesced. And it's really inspiring, the work that they're doing. And without any further ado on that front, I'm going to turn it over to Ava, who is our team coordinator for the first King County team. So Ava, over to you.
Thanks, John. So John mentioned there's about 7, 8 of us. And so this position is a really interesting position. So we're neither a data entry workers or, on the phone constantly. What we do is basically we give accurate COVID-19 guidelines about isolation and quarantine dates. No day is ever the same. And there's no amount we're not, we don't have to make a certain amount of calls a day. Every call is absolutely different. It can be from 30 minutes. I've had calls from 17 minutes and I have all the information I need. And I've also had calls for 3 hours. I think my longest call was 3 hours and 30 minutes with a family of 11 plus people and multiple referrals. And so it's, this job is really interesting. The work week starts in different days. For me, my week starts on Sunday to Thursday. And there's 2 shifts. Shift 1 is from 8:30 to 5. And then shift 2 is from 11 to 7:30. And one of the most amazing things as a returned Peace Corps volunteer is we get to talk to people from diverse backgrounds. We get to use multiple interpreter services, but also I'm a bilingual tracer, but I've used other languages that I know to help build rapport, because that's the real gist of this. It's the main skill sets are interview elicitation. So how much information, how can you draw out anything that you need? How do you obtain the information that you need? And how do you educating about COVID-19 isolation and quarantine? There are so many misconceptions out there. So it's fascinating. And even though we're working from home and it's during COVID-19, we never stop talking to people. So there's 2 other contact tracers.
Thank you.
And Lauren and sorry, Dan, go ahead.
Missed the handoff there. Lauren, would you like to add to what Ava's described and share your personal experience?
Yeah, for sure. I think, yeah, everything Ava said, like everything you were saying, I was like, yes, all of those things. My favorite part is being able to connect with so many different people from such different backgrounds, talk to so many people with different languages every day. And that's super fun. My favorite calls, I mean, we get such you get people on the spectrum. You get people who don't have any interest in talking to us. I had a woman today who was like, I just don't want to. That's fine. That's great. No problem. And then you get people who just give like 1-word responses. That's okay too. And then you get people who are excited to kind of have a conversation with you, or who have tons of questions and just want to know all of the things you can share. And those are my favorite ones. And I shared with a lead contact tracer the other day, one of my conversations, and they were like, those are the ones you have to savor, because the people just want to connect. And that has been, that's my favorite part of this job, is when those people are excited to talk to you, and knowing that I it's crazy. Before the training, I didn't know one thing about isolation and quarantine. And now I feel like, in such a short period of time, I feel very confident in this job. And I remember in our training, our trainer just kept emphasizing, like, you guys are going to get it. It's just going to take time. And we as a group just kept reminding each other the same thing. Um, we're going to get it. It's tough now, but we're going to get it. And now a month and a half later, I feel like I've really got it. And so it's wonderful to be able to share that information, that it's like the education background in me coming out is like, it's so fun when people ask questions to be able to go back and forth, make sure they get it, to learn more about their life when they're willing to share about their life and connect a little bit, like, oh, your birthday's same month as mine, or, just little things like that. Or if I do have somebody who's Filipino, like throwing in little bits of in pieces there, or different cultural things that will come up. That's really fun. And then another one of my favorite parts is having this NPCA group. I imagine the other contact tracers who train together probably also have a nice bond, but I love our small little pod of people. We have a Skype message that we usually have going during the day, and it's so nice to just have our little pod, because with so many contact tracers, it can be hard to feel, and working remotely, we all know it's so hard to connect. And so it's really nice to have our little crew of people to be able to connect with throughout the day. And we all share the same, such similar backgrounds. So it's just really nice. It's been an easy team to flow right into.
So by way of introduction a little bit, Ava, you had served in the Peace Corps about 15 years ago or so, is that right?
Yes, in Uzbekistan, 2000 to 2001.
Yeah. And Lauren, more recently?
Yeah, I was 10 years ago, 2010 to 2012.
Right. And then most recently, I'll introduce Jerome Sianko, who was evacuated back in March. Jerome, you can introduce yourself a little bit more.
Hi, everyone. Yes, my name is Jerome Sianko, and I served most recently in China from June 2019 to this past February. And I think what I have enjoyed most of having this opportunity to work with the NPCA and be a contact tracer is that idea of our Peace Corps service, that whether you're someone like me who was recently evacuated and your service was cut short due to COVID, or you served a couple of decades ago, really it's that idea of service that volunteers are drawn to, that I'm thankful for this opportunity to be a contact tracer, to bring that service back here domestically and be able to meet the needs of our different communities here in the U.S. And for somebody, for me, I grew up here in King County, but when going to school and going to the Peace Corps, haven't really lived here, I guess you can say, for a couple years. So this was also a great way to reconnect with the place that I grew up and try to serve as best as I can in this capacity. And it's exciting. A couple of days ago, we were on the phone with an all-staff meeting with the head epidemiologist at the University of Washington. So it's also that knowledge component that those before me have mentioned, that you're talking with experts on COVID-19. You're up to date on the knowledge of the vaccine response, on where it is in your own county, and it's great having that knowledge, not only so you can use it while on a call in this role, but also in your daily life, that you're able to refer friends or family members with the knowledge that you're able to build up. So again, this role, similar to the service of a Peace Corps volunteer, doesn't last forever. That obviously as a volunteer, you're gonna end your service 2 to 3 years after you start. With this role, hopefully COVID will end, and it'll be exciting to say that you were able to play a part in it, to play a part in this COVID response through being a contact tracer. So yeah, thank you.
Thanks, Jerome. We had question and answers at the end of this agenda, but I feel like after your introductions here, now's more of the appropriate time. We want this to be as participatory as possible. So anybody with questions, if you want to unmute yourself or put them in chat. And I thought I would just get the ball rolling here. Joan, you mentioned there's a lot of interest now, and kind of the next step is everybody's focusing on this vaccine. And what are you hearing about from King County on contact tracing? Will this continue to be a need? And any of the three of you can answer this. But at some point, will you shift completely? Will King County Public Health shift completely from contact tracing to vaccination campaigns, or will contact tracing be an ongoing need?
Definitely, contact tracing will be an ongoing need. And the thing that I didn't know before starting this role is contact tracing is not something that's new. That especially with HIV and AIDS, there's contact tracing there. So there's always going to be contact tracing in some capacity. But with the vaccine, even with the vaccine, contact tracing specifically for COVID-19 is going to be needed, especially throughout the coming year. That here in King County, we're releasing the vaccine in phases. Obviously, with phase one being healthcare workers and frontline workers who are working with COVID-19 patients. But definitely in the near future, at least for 2021, contact tracing is something that is going to be very much a need for COVID-19.
Also, with the vaccine rollout, the line where each individual is in line to receive that vaccine is vastly different. So it could take another year until the end of the line, and that's with millions ahead of you, until you're ready to receive that vaccine. And so, like Jerome said, there isn't going to be less of a need. In fact, every day we have over 700 new cases just for our group within King County. That drops with new index cases, new people that have been that have contacted COVID-19. And so there's not many of us. I think there's only 70. So the need is extremely high.
Something that I found encouraging, we had a new prevention staff meeting a couple weeks ago maybe, and the director of public health was talking about how pre-COVID, we weren't ready for COVID, and how could we have been? But he said that public health is historically underfunded, and so he has been petitioning to have much more funding so that even after COVID has started to kind of drop down a little bit, that we would still have a great number of staff members. So I don't know exactly what that means, for us for the future, but it sounded like contact tracing was going to remain more of a priority in the future.
And I'll just add, John and I were on the phone earlier this week with another potential partner. Not ready, that we really think might pan out here, but we're not ready to announce. But they're talking about hiring contact tracers already for June of next summer, and they're wanting 50 to 100 people in one state, and that's just a small portion of their need. So this is definitely an ongoing need for states, and they're predicting way in the future that they're going to still need it. What other questions do we have from the group? I'd love to for you to just take over. Again, feel free to just unmute yourself or put questions in the chat and we'll read them out.
Well, this is Josh. First, I just want to thank everybody so much. Your enthusiasm is pouring through my computer in the Zoom. So thank you for sharing your enthusiasm and the information. I was curious about the application process. I think that was on the agenda.
Yeah, absolutely. So there's two things two opportunities here. One is the immediate need, which I'd like for John to talk about a little bit more in just a second, and the future needs for these other states and localities that we're talking to. John will talk about the current opportunity in King County as we expand the team that you're hearing from now. But for future needs, I'm going to share my screen here and show you what we're looking at. Here we go. So are you seeing my website here?
Not so much.
No. Try now.
There we go. Okay.
No.
Well, I tell you what, Dan, while you figure, is that it? Is that what you want?
You see a website here?
I see Catalina Island.
Nope, that's not it.
Dan, you were dragging it and you dragged it off of the screen. So maybe if you drag it back onto the screen.
All right, so I've got two screens.
You did have it.
Coming back, coming back, coming back. All right.
There you go.
All right, so everybody who is an RPCV is eligible for a free NPCA membership, and all you have to do is to express interest in being called for Peace Corps responses, to go to the NPCA website, peacecorpsconnect.org, and edit your profile. Our system can be a little bit slow, but sometimes people have done this in the past and your information's run out. So we always like to remind people to keep their profile current. Here we go. There's my information you're seeing. You'll probably see a lot of my personal contact information, but if you scroll all the way down to the bottom of your basic profile, you have a section on interest in emergency response positions and other volunteer opportunities. There's some boxes you can check. Say what you're interested in hearing about, whether it be domestic or international opportunities, or short-term farmer to farmer is another program that we administer overseas for RPCVs uniquely. You can tell us what sort of position you're interested in, full-time, part-time, whether you're open to being a volunteer or only interested in paid or stipend positions, and when you're available. So basically, we just need you to fill out these fields if you're interested in contact tracing positions, and we will be able to run a report for partners of who is in our database and interested in these sorts of jobs. So that is for future needs. John, I'm going to turn back to our PowerPoint presentation here, and you can talk a little bit about the King County positions.
Great. Well, see, we are actively recruiting here for King County. And we're looking for probably 10 to 12 new contact tracers. They may, we realize, come in groups. So the way that King County operates is that there's a training program that everyone goes through. It's actually a paid training program, and they just have training scheduled on specific dates. So one date is going to be starting the 28th of December, one group, and then another group will be starting the 11th of January. So those are the two groups we're recruiting for right now. Positions are paid and full-time. And with home-based, obviously, with healthcare benefits. It's a 40-hour work week, a 40-hour commitment. We're looking for folks who can commit through at least the end of March. And depending on the needs at that point, there may be an extension. But the way that it works is if you apply, and you can apply through the website that Dan mentioned. You could also send in a CV to Peace Corps Connect, and we will take a look at that. We'll do an initial interview, and then we will pass on names to King County. They will do some vetting, and then there's a 5-day technical training, at which point you get your computer and your headset, and then you have an observation where you have an assessment where you were observed. So the training part, once you've passed the interview and start the training, you actually become a paid employee of NPCA at that point. But your continued employment is contingent on King County doing an assessment and basically making sure that you have these skills required to manage an interview correctly. And so, you know, that's their quality. The ultimate quality check is that you actually do an interview. You're on the line talking to somebody, and there is a supervisor from King County who's shadowing you just to listen in and to see how you do. So that's just a broad brush overview of the position. We can go to the next slide here. Okay. And a little bit about the job description. You know what, actually, I'm thinking, you know, there are people who actually do this for a living who are on the line right now. So Ava, you want to take over the job description part?
On the spot.
Sure. So the job description, all we do, every person that we contact is COVID-19 positive. And we conduct in-depth interviews that really dependent on their situation and their need can last from about 30 minutes to a longer period. And Jerome and Lauren, feel free and afterwards share how long, you know, what the average is and what your shortest and your longest interview has been, because I'm sure they all differ. So we accurately share information. We're part educators about health and quarantine guidelines and facilitate linkages to testing and other support resources, which is after the call, you send text messages in addition to referring to other departments and regarding need. And the people that we speak to, for the most part, they range tremendously. I've had people that I contact in extremely high income zip codes and with no additional need. But the majority of the people that we speak to, they have extreme need. And COVID-19 has hit everyone extremely hard. And we see discrepancies in ethnic and racial demographics on how it hits. So part of our job is we want to offer as much assistance from public health in Seattle and King County, but also to assist them to make sure that they're isolating and quarantining, because the most important thing that we do is we make sure that COVID-19 does not continue to be spread in the community and within family groups and in our region and state. So we always follow up on requests for support. We enter interview responses into multiple data collection and communication platforms. The majority of what we use is called RedCap, and it is administered through UW. We use Mozio, which is a text messaging system, Skype, Zoom, and Office 365, and other things that we can use on the site to assist us as well. The most important thing is we don't keep personal information. We follow and adhere to HIPAA guidelines. So speaking to us, when people talk to us, it is, for some part, it is confidential, and we do not share their names. We never want them to go back and talk to their employers or their, not employers, but we don't want them to go to stores or anything and say, oh, I was in your store and I tested positive. So we contact trace who they have been around and who their immediate family is. So we stay up to date and compliant with daily guideline changes. This changes, it's fast moving and it's fast paced. And one day you're doing something this way and the next day you're doing something in like a different way completely. And client confidentiality is important.
Thanks, Ava. And one thing I'll just highlight that Ava said about the technology piece is just really important that our contact tracers be comfortable enough with not necessarily with these systems, they can be learned, but with IT in general to be able to do the hard work of contact tracing and not get too bogged down in the what you're clicking on when.
Yeah.
So I'm going to move to the next, and maybe John, you can take over on
Sure.
Yeah.
Yeah, and just, you know, I think that as you, you know, can, oh, sorry. Am I, no, I'm not on mute. Good. Okay. I'm not sure how much the group knows about contact tracing, but I think that just any knowing about COVID, you can assume that it's going to be a little bit stressful. It's going to be fast paced. Things are going to change all the time. You know, and it does require being able to kind of function under stress and maintain your composure, and maintain your calm and provide accurate information, but also to be spontaneous. It's kind of a, you know, using different sides of your brain. You know, on the one hand, you're trying to have as normal a kind of a conversation as you can, and to you know, to get people's attention, to gain their trust, so that they're willing to both listen and talk. And at the same time, you've got a database or several that you're going back and forth between, you know, your conversation and then making sure you get the data in accurately. So it does require some fluidity in being able to kind of carry on a normal conversation and, you know, work with a computer at the same time. And I think that's one of the skill sets that's probably kind of unique to the position. But we found that, you know, with Peace Corps volunteers, they're used to multitasking and they're used to things not being the same way, happening the same way twice. But you know, but there is that other element, which is that we're working with databases, and if we're giving out wrong information, that's a public health issue. If we're putting wrong information into the database, that's a different public health issue. So you know, you've got to be accurate. You've got to be able to stick to script, but then to be spontaneous and to, you know, follow leads as they come up. So those are just some of the general skills that we found people were required. So obviously communication skills, strong oral communication skills, ability to establish a relationship, establish a rapport with somebody who is in a very different background than you are, to, you know, be non-judgmental about it, to be understanding, and you know, and to be sympathetic. You know, you're, by the nature of your job, you're giving people bad news, but you're also helping them. So, you know, so the other aspect of this is, you know, in addition to being able to be sympathetic, you've got to be accurate. You know, the information that you're providing is important public health information, and you need to, when it comes to the public health information, stick to the script. You know, and at the same time, you know, that script may change from day to day, and the different folks that you're talking to, right? You know, there is a degree of spontaneity into it, and there is a kind of a, you know, you're following leads, and one leads to another, and so you have to be able to adapt, but then you have to be able to get back to script. So technical skills, strong attention to detail. You know, there is a guideline, there's a script that you're going to be working from. And it is very important to be able to relay that information accurately. I think that, as far as King County is concerned, that is a non-negotiable, is that, you know, because this is public health information, we need to be accurate in what we're telling people. But at the same time, you know, you've got to be able to improvise based on the situation. If you're talking to one person in the family, and then I think, as Ava was mentioning, then you end up talking to 10 more people. You know, that does require a certain amount of spontaneity and just being responsive, right? You know, and sometimes you're talking to folks who don't want to engage. You know, you're telling them something that they don't want to hear. You're somebody they don't want to talk to. But you have important information for them. And so finding a way to kind of establish a rapport against us, you know, against some occasional resistance is going to be another skill set that is important for this work. And then, as I mentioned earlier, the being able to navigate computers and communication software, data collection software, and to be able to do that without getting, you know, stressed out about it, because the phone calls themselves can be at times stressful. If you're stressed out about working the computer at the same time, then it's just we find it's particularly hard for folks. So good computer skills are absolutely essential. Okay, is that it? I think that's it. All
That
right.
was it. Yes. So
Right.
let's come back to the
Stop listening to me and start talking to our contact tracers here. And so, did I get it right, guys? Is there anything that you'd add? Anything that surprised you in terms of when you walked into the job a month and a half ago and now?
I never thought I would be so tired just speaking to people after a shift.
Yeah.
And our systems that we use, there's everyone across the state is using the same systems, so they crash sometimes. So being able to have someone still on the phone and keeping them on the phone and interested and engaged while you're navigating a crashed system is, you know, Peace Corps volunteers are made for that skill. So.
Yeah, and just to add on, I think something that surprised me is like even though the day to day seems kind of routine, and you do have some hard conversations, I like to think about it like a chess match, right? And if I'm on the call with somebody, I think about it as a game almost where I'm interviewing, navigating, trying to get a sense over the phone, obviously, like how are they responding to these questions? How can I get the information that I need? And also be of a resource to them. How can I give them the most services and help that they need? So it's definitely a chess match of how can you navigate it, and instead the end goal not being checkmate, but how can you leave both parties, yourself as the contact tracer and the individual that you're talking to, how can you leave both parties satisfied and left in a better place than when you initially made the call?
I think one of the biggest things I've learned was from one of the, so after you graduate and you like go on to do your own phone calls, the lead contact tracers will observe you 3 times, once a week. And then after that, we're observed once a month just to make sure we're, you know, still providing the correct guidelines and everything, and to give us advice. And I had wonderful advice from each of the leads. They all had such different things to share. But one of the favorite things that I learned was just trying to like you were describing it earlier, John, like it's such a dance of navigating like each person's personality, trying to make it so it's not such an awkward interview where it's like but make it flow a little bit more. And yes, you have your script, but it's like knowing when somebody mentions something and the question's all the way at the bottom of the page, knowing, okay, well, they answered that. I'm going to go down, I'm going to answer that, and like kind of feed off of that and make it into this nice flow rather than this awkward, like where they really truly feel like it's an interview, because that can feel uncomfortable. And then another piece of advice that I found really helpful was if people kind of feel standoffish or if they're feeling like you're just interrogating them, to try and emphasize like, I'm just here for, like, our role is just to support and to like provide good information, and to like, we have so many, King County has such amazing resources to offer for so many people. It just blows people's minds when we're able to like describe what we have, like stipend programs, free transportation, free testing, all these different things for people, grocery deliveries for free. And so if ever I'm feeling like somebody's hesitant to provide me information, or like we have to ask, you know, for contacts, for their household information, birthdays, names, friends, and if they're really like, why do you need this information? To like just feel confident and like, we just want to help. We're just here to help. We have so many resources to offer. We want to have as much resources out there, and we want to have everybody feel as knowledgeable as possible so that they can keep spreading the knowledge. And it's been such, it was such helpful advice, because now I feel so much more confident in like, if people are uncomfortable with me, just like letting them know what we're here for. And people respond really well. You know, like most people we talk to are so friendly and so grateful to chat. We do have people who are not so happy to talk to us, but that's more rare. And so, yeah. And then by the end of the conversation, most people are like, thanks for the work you do. Thanks for the resources. Thanks for, you know, they're just grateful. So that it's been really nice to have the lead contact tracers observe us and provide feedback.
Great. And I will say, I'll jump in here to just give a tip of the hat to King County, who has been an awesome partner in this, and have been very supportive. As it turns out, of course, the woman who is heading the contact tracing program for King County is a Philippines volunteer. So we have a real strong connection with them, a strong relationship, and they've been very supportive. I think the fact that they like the work of the team well enough to ask for 10 more is certainly an indication of the positive nature of the relationship that we have with them. So this is Q&A. Are there any other questions? You've got a panel of 3 experts right here, right now, and this would be a great time for any last questions.
Hi, this is Josh again. Just curious, how about in a day, I know it changes week to week, how many folks just straight out hang up or don't want to talk at all?
That's so rare. Sorry, Jerome, go ahead.
Oh, no, I was just going to agree with you. That is very rare. Like, for example, today I made 20 calls. Not every call is an interview. I left about like 15 voicemails today. But out of the maybe 6 or 7 people that I did engage with today, only one person politely, all my refusals have been very polite. Usually either the people who don't want to talk with me, either are near the end of their isolation, think that they know what they're doing already, or just don't simply want to talk. But it is very rare, as Ava was going to say.
Thank you.
So I'm wondering, among the group here, are there Washington State residents? I know, yeah, Josh, you're a Washington State resident. Okay. Yeah, I would recommend you get your CV in as quickly as you can.
And again, for this, there is a vacancy announcement for the King County position on the NPCA website. So you can follow the instructions there. Basically, that is to send a CV to the hr@peacecorpsconnect.org email address. I'll put that into the chat here. You can send it to me directly, dan@peacecorpsdirect.org, John as well, John at peacecorpsconnect.org. We'll get it in the right place. But again, for out-of-state, non-Washington State residents at this point, again, the NPCA website, updating your membership profile is what we need to be able to do so that we can match skills and opportunities. One thing I wanted to say, we're setting the bar really high for future opportunities with this King County partnership, because it is a very, I would say, advanced effort compared to where other states are and who we've spoken to. We also treat the contact tracers quite well, on par with what professionals with King County are paid, and similar benefits. But I know that as other partnerships develop, the pay is not quite as good. They're looking maybe at more AmeriCorps type programs, maybe no health benefits. It's really going to be hit or miss with what the benefits are for programs as we work with different partners. Our NPCA will always try to get the best deal for our RPCVs, but it really depends on the partners that we're working with.
And for those of you who are not Washington State residents, please do apply and let us know that you're interested. We are in a daily process of negotiating. We've been pushing hard to open up recruitment to a national level. But of course, we try to be responsive to the needs and the constraints of the partners that we're talking to. And so right now, this seems to be, it has been a constraint with King County. We're looking to get beyond that. I think they recognize the quality of the staff that we've been able to provide. And our argument to them is that we can just provide more if we can recruit nationally. So we are actively trying to scale this up to a national level, and it will happen. You know, we're just going to keep pushing until it does. So don't feel discouraged. King County is just a little bit, they're a little bit ahead of the curve, but what we're definitely looking to recruit nationally as soon as we can.
I have a question, and it's probably stupid, but when you say CD, that's a resume?
Resume, I'm sorry, yep.
Okay.
Curriculum vitae, yep, that's a resume.
Oh, okay.
In other words, yeah.
Those Francophone Niger RPCVs, they're always fun. Yeah.
Yeah.
I had a quick question too. This might be silly, but is the training in person or online?
Yes, for the first cohort, it was in person, and you guys, contact tracers, can say more about that. But as we're talking about the next round, looks like we're going to try to do it all remote.
Also, I don't know if this is appropriate or not. Could you go into the compensation rate specifically for the contact tracers?
Sure. For King County, it's $30 and change per hour, so that's a pretty competitive salary, and probably much more than we would be able to do in other states and other opportunities.
Yeah, so as we expand, it will depend on what it is that the health department we're working with is able to offer. What we insist on is that it be parity, so that if other contact tracers are getting paid, you know, a certain rate, that our folks are treated equally. And so as that turns out here in King County, everybody's getting $30 and change. With other states, it's different. But we'll take that on a case-by-case basis. And what you can be assured of is we'll negotiate to get, you know, as much as we can for our folks.
As we went into this, we didn't think we'd be able to offer health, for example, to the current group, but we were able to get health benefits.
Yeah. Bargaining, it's a Peace Corps skill.
Yeah. So thanks, Spencer. Yes, we can talk further offline as well. And yeah, I see a number of other names on here. If you have any other questions, please put them in the chat. But I also want to respect the time of our contact tracers who have already had a long day, and I'm sure are ready to enjoy the weekend. So let's just take another minute or two here, and if there's any other last questions, we can have time for maybe one more.
Hi, this is Jocelyn. I am a Washington resident, so I'm very interested in the position. And I had a question for bilingual folks. So I do speak Spanish as well. Of course, not probably as on par as a certified medical interpreter, but I was just wondering how the position kind of navigates that, if we're allowed to speak our other language, or if the training suggests that we go through the medical interpreters.
Ava, you're up.
So, Jocelyn, I love hearing that question. I'm a Spanish COVID-19 contact tracer as well. And there's a deep need for Spanish-speaking contact tracers. So the way that is handled is you would go through an assessment of your Spanish skills once you pass the training and start handling contact tracing on your own. And they'll put you in that assessment as soon as possible. And it's contracted out through an interpretation and translation service. And so you speak with a third-party individual. It's usually 15 minutes, and then it's a conversation. So and then you're graded on that. And you know, this isn't at the level of medical interpretation. It's are you conversationally fluent? It doesn't matter, you know, your tongue loosens after a while but we need more Spanish speaking contact tracers.
Great, thank you so much.
Thanks, Justin.
And Ava, can you talk a little bit about working with interpreters? Because there's a whole, you know, that's a resource that you have that's available to you, and you can call on folks who speak all sorts of different languages to help out, right?
It's amazing. You know, I've learned about languages I had no idea it existed, and it's incredible. So you contact a contact tracer, and if you hear, you know, we're extremely factual and to the point. If you hear that someone's struggling, one of the questions immediately is, you know, do you feel comfortable continuing this conversation in English? And if not, what language are you comfortable with? I can call you back with an interpreter. And so we have a third-party interpretation service we immediately call, and then we dial for both parties, and then the service starts. And usually it does take a little bit longer, but it's such an invaluable service. We're able to reach and communicate with populations that public health we wouldn't normally be able to. I've had quite a few. It's impressive, and it's pretty great. Lauren and Jerome, do you want to speak to your interpretation calls? If you've
Yeah, I can just quickly pitch in here. The interpreting service has been phenomenal. I see them a lot as an ally on the call, helping me. Obviously, as a Peace Corps volunteer, you've worked across cultures, but really with that language barrier sometimes in making calls, the interpreter really helps navigate that, and I see them as a really great benefit to have on calls. Especially King County is a very diverse community, and so helping meet that need of a diverse community that we have here.
Yeah, second all of those things. I mean, at least daily, I probably have a couple of interpreted interviews that I do, and all the interpreters have been so fantastic. It's been a great experience.
Excellent. Great.
Well, I just want to start wrapping us up here with a huge thanks to John, but especially the 3 contact tracers who, like I said, been working very long days and working very hard and doing a great job making NPCA proud and the Peace Corps community proud in general, so much so that our first partner is already looking to expand their efforts with us. So I'll offer you all a chance to give any parting shots, but I want to thank everybody for joining. Again, we will entertain any conversations with anybody who's interested in learning more one-on-one, but for all of those who wanted to attend this session and could not attend live, we are going to post this recording to I'll share it with anybody who registered for the event or who might express interest in learning more in the future. So you'll be able to find this later.
And we encourage you to, share this with your network. If you have other folks who are interested, please let them know. Here in King County, we're focused on hiring for our team, but King County is also hiring non-Peace Corps people. So there's plenty of need. We have our way of doing business with our return volunteers, but there are plenty of opportunities to serve here, and it's vital work. And this team is just been awesome. It's been inspiring to see them do their jobs. So
putting my email into the chat here. So please get in touch if you haven't already.
All right.
Good night, everyone. Have a great weekend. Stay safe, stay engaged in the Peace Corps community, and we'll hope to hear from you again soon.
Okay. Thanks. Bye.